Please stay protected during the pandemic. My name is Michelle Escoto. I will be your moderator for today. As well, we will be talking about equality and the COVID-19 vaccine. I am one of your four community educators trained to answer your COVID-19 related questions and to help connect you to the services you need to get tested and vaccinated. You can contact a community educator who attended into a at covid.ed at acbgc.org. Nosotros hablamos español. This is the second of our 4 CovidEd town halls, all which will be available on the Boys and Girls Club Atlantic City YouTube channel. At the end of this town hall, we will be putting the names of everyone who attended into a hat and picking the winner of a set to win a set of AirPods. Now, I'd like to introduce our speaker, Christian Ragland.
Awesome. Good evening, everyone. First, Michelle, thank you for that lovely introduction and continued work that you're doing around this. I'm excited to be here. Let me do a couple of housekeeping things here. I want to thank the CEO of the Boys and Girls Club of Atlantic City, Miss Stephanie Cook, who is, I consider, a friend, and she has been extremely helpful with some things that we're doing here at AtlantiCare along the lines of DE&I work. So really grateful for that opportunity. Of course, my new friends, Mia and Renate, who have been really helpful to me, and I've adopted them as family. So if you don't think we're family, you are in my mind, and I'll keep it there. But with that being said, I want to welcome everyone who is taking the opportunity to join us tonight to have a very lively conversation around COVID-19, which is the hot topic in today's society across the world, where we are all dealing with a pandemic. And so I know there are people still joining, so I won't jump right into it. But I would like to just say that we all have learned so much in this pandemic, not about just ourselves, but about our communities. And what a great opportunity. I believe that these are opportunities that we have to really engage each other about pertinent conversations. So with that being said, let's jump right into this. So my name is Christian Ragland, Christian Dupree Ragland, if you know me that well. I hail from South Jersey. I am a graduate of Absegami High School, a graduate of Penn State University, the Pennsylvania State University. I'm going to say we are, for those who agree that Pennsylvania State University is the best university out there, but I will leave that to you all. But with that being said, I also have been in HR, human resources, for about 10 years. I have matriculated into this role at AtlantiCare as the manager of diversity, equity, and inclusion, which we're going to talk about in a little bit. But I work directly with Sharice Pfizer, who is our Chief Diversity, Equity, and Inclusion Officer at AtlantiCare, and we are pertinently responsible for the strategic efforts around DE&I. And so what does that mean? So at the hospital level, at the health services level, it is our responsibility to create an inclusive, equitable, and diverse atmosphere community so that not only our employees feel comfortable, our patients feel comfortable, but our communities feel comfortable. So with that being said, why am I here today? I'm glad you asked. I am here to talk a little bit about COVID-19 and the equity around COVID-19. So before I go any further, I have to level set the room. I have to level set the room. I have to make sure that we all even understand what the terms even mean. So let's start with some basic things. I'm going to share my screen here. And well, first, before I share my screen, let's just talk a little bit about diversity, equity, and inclusion. Diversity, in my opinion, in my definition, is the culmination of different things, different thought processes, different maybe ways of doing things, different races, ethnicities, gender identities. Are you differently abled? Are you someone who is one to think that you do things differently than the next person? All of those things congregate a concept of diversity, meaning that there are a bunch of different things. Inclusion is what I like to call the glue. Inclusion is where you take those very diverse things and you find a way to put them together for the use of things. And this is where a lot of organizations get in trouble, where they get to a point where they say, oh, I have diversity. And so what they mean is they have all these different things, now all these different silo groups, but nobody's talking to each other. Nobody's working with each other. And so you can't have diversity without inclusion. So I want to share my screen because I have to level set. I got it before we talk about equity. And before we talk about the COVID-19 vaccination and all of these different things, you have to understand why diversity and inclusion is extremely vital to understand. So I'm gonna share my screen here, and hopefully I share the right screen. All right. So I like to use this tool when I'm doing new hire training, when I'm looking at different individuals that come into the organization. This, I believe, and I wish if this was more interactive, I would ask you, what do you see here? But for the sake of time, I'm going to tell you what you should see here. So what you should see here is puzzle pieces. So under diversity in the left column, you see a bunch of different colored, different pieces. Okay, cool. That's diversity. Inclusion says, let's utilize all of these puzzle pieces to create the most beautiful square you'll ever see in your life. Isn't it? That's the most beautiful square you'll ever see, I promise you. But what's the point? Diversity says, let's take the differences and let's create this beautiful square that creates inclusion. Okay, so I'm always mindful of making sure I say this before we talk about equity, because you can't talk about equity until you appreciate inclusion and diversity. So thank you for coming to my TED Talk about diversity and inclusion. Now let me move into equity. All right, so let's talk about equity, where the conversation is geared towards the COVID-19 vaccination and how equity plays a role. And so let's talk about it for a second. So what you see on your screen right now, let's specifically talk about what you see on your left side of your screen. You see the term equality. All right. Now, a little disclaimer, some individuals get equity and equality confused, but let's talk about it. Equality, as you can see here by these three individuals, represents three individuals, different sizes, standing on the same box. This is where you have to understand diversity, because you see three different people, but they're standing on the same block. Okay. So in the eyes of equality, that's equal. I don't think anybody would disagree. They all have the same size box. But equity, which we're getting into today, deals with, even though you may have the same size box, but do you have the same barriers? Do you have the same access? Do you have the same fair opportunity to see something? And so in this particular analogy, you have three individuals on the left trying to watch a baseball game. All right, so you have an individual on the far right who probably is a lot smaller than the person in the middle, who is smaller than the person on the left, but they're all standing on the same box. But if you look at the right side, equity says, all right, let's look at this. Let's take one box away from the person who doesn't need it so that the one in the middle can keep their box and the person on the far right can have two boxes so everybody can see the game at the same level playing field. That is the difference between equity and equality. Equality gives you things all equal. Equity says that everyone has fair access. Simple as that. Am I making sense? Give me like a nice, if you're muted, give me a clap, give me something like that. I should have never even clapped. I don't know if I hurt your ears doing that. But with that being said, that's the difference between equality and equity. So let's jump into it. So I'm going to stop sharing my screen here. COVID-19 and equity. So what we realized, and I'll speak for myself on behalf of AtlantiCare, when we started doing the COVID-19 vaccination. Wait a minute, I gotta, hold on. How many have the vaccination? Show of hands if you have the vaccination. Okay, 1, 2, 3, okay, cool. Now 4, thank you. And those of you, I can't see your camera, I'm just gonna assume that I'll do a 50-50. Half you have it and half you don't, okay. So when you talk about equity, this conversation is not about telling you that you should get the vaccination. When you talk about equity, equity says, do you have the fair opportunity to receive it if you wanted to or if you did not want to? Simple as that. Today's conversation is not about me telling you, you need to go get the vaccination. I don't know what you're doing, get the vaccination. And I am vaccinated, as you can probably see on my gigantic button that AtlantiCare gives us that says I'm vaccinated. But it says, listen, equity says, hey, even if you don't want the vaccine, you still should have the same opportunity to have it. So a lot of things have been transpiring since the pandemic. We have people, let's just call it what it is. Let's just say the pandemic has exposed a lot of systematic injustices that we see today. And many of you, if you have eyes and ears to hear and eyes to see, you see and you hear exactly what I'm talking about. There have been so many things that have been unearthed regarding the fact that there are people who have been systematically oppressed, systematically been given barriers. But we come today to level set and say, all right, let's talk about what we need to do to make sure people have fair access. So let's look at it from the standpoint of COVID-19 vaccine. So all year long, we have been dealing with a pandemic. It has been a horrible illness. People have been put on ventilators. People have been losing loved ones. Look what's happening in India right now. I don't know if you all follow the news, but look what's happening in India. The crisis, I don't even think the word crisis is strong enough to understand what's happening, the totality of what's happening in India. But you have people in India and all over the world that are suffering. In India specifically, you have people who are waiting in cars to die because they can't get access to a hospital room because they're overcrowded. People can't perform their proper funerals, the proper religious rites, simply because the pandemic has run rampant with variants. And so we've all been dealing with these different things. And in the midst of dealing with this very pandemic, we've also noticed there has been inequality and inequity. And so the reason why I'm so happy that the Boys and Girls Club of Atlantic City has taken this opportunity to have this conversation is because you only know what someone teaches you or what educates you. You know, we have to educate you on these things so you can go out and be the change that we need you to be in the community. And so when you look at the COVID-19 vaccination, what has happened? Let's talk a little bit about the people of color, the history around people of color. So there's always been, I heard Dr. Eileen last week on the town hall mention that there has been a lot of hesitancy around the COVID-19 vaccination. And a lot of that is due to people, maybe validated reasons, of course, history, right? Where there are individuals who feel that the vaccine may be a test, or they don't trust the government, or we heard everything, or we don't know if it's going to affect me the way that it affects everybody else. And so you had a lot of hesitancy. And so what happened was, I believe, and no offense to anybody who's of the media, but I believe the media portrayed the vaccine as, well, at least to a certain group of people, that you shouldn't get it because there's a history there of not working proportionately to anyone of certain demographics. Okay. And so what happened is you had a lot of individuals say, I'm not getting a vaccine. I'm not getting a vaccine. The Tuskegee experiment, they start quoting different historical functions, and which are, again, validated. But when you talk about today, people were going off of maybe someone else's experiences to make sure that they didn't have access to the COVID-19 vaccine. So why is that important? Well, it's really important because if people begin to say they're not getting the vaccine simply because history says it's going to be a bad thing, what happens is then people don't take advantage of the resources available to them. And then you have communities that suffer because not everybody's fully aware or knowledgeable or educated about the vaccine. And now you create this circle of life that breeds a culture of ignorance around something that's supposed to help them. And so, and then what happens is when people don't take advantage of the resources, they leave. And then you have communities that suffer because they have lack of resources. So a perfect example of how we dealt with this at AtlantiCare. So we were dealing with the vaccine. We had a 65 and older campaign. So many of you remember the mega site opened up in February of this year. And it was all news about the mega site. And people were saying, oh, go get the vaccine. And I don't know if anybody registered online, but it was a very perplexing process at one point because you probably had 30,000 people ahead of you. Anybody had that experience where you went to go register and it said, you are 45,000 in the back, right? You are pretty much, they just should have said, you're dead last. That's what they probably should have just said. They should have probably said, go get dinner, go wash your clothes, go check on the kids, then come back tomorrow morning. We'll see if we can get you in. That was really a very tough process. So the news came out and data started coming out specifically in Atlantic County. And it started showing that only one particular population was getting the vaccine. It was only one particular population that was getting the vaccine. Anybody want to take a guess what that population was, just out of curiosity? Oh, wait, this is supposed to, wait, am I allowed to even do that? Should I wait to the end to ask questions? Okay. Well, listen, I was just curious. Anybody know what the population looked like? I'll give you an extra set of beats if you answer the question. I didn't say they worked, but I just said I'll give you an extra set. What did the population think look like in Atlantic County of the first group of individuals getting the vaccine based on the process I just told you? You're afraid to say it? 65 and older, white, females only. Okay. So we looked at that data and we said, something's not right about this. We know that the people are saying, I'm not getting the vaccine. We know that people are saying that they don't want to do it because of hesitancy, but we started to do a little bit more research. And so what we did was we started reaching out to local pastors in every community. We started reaching out to veterans. We started reaching out to the municipalities. We started reaching out to our Hispanic communities. We started reaching out to Vietnamese priests. And what we found was that people wanted to get the vaccine, but they didn't have access to it. They didn't have a computer to register. They didn't have a child to help them as they were 35,000 in line. They didn't have someone to get them to the mega site to get the vaccine. And so what narrative do you think that played? So where we thought because people weren't getting vaccinated, it was because people didn't have access to it, or people didn't want to get it because they were afraid of it. Simply, it was because of a lack of access. It was simply because they had no access to the vaccine. And so while we put this mega site up and we said, everybody come get the vaccination, it didn't mean that everyone had the same access to the vaccination. It was equal, meaning that you had the same opportunity to register, but it didn't mean it was equitable because you had the same access in different areas. So why is that important? Because we need to make sure that anytime we're dealing with healthcare issues, equity has to be at the forefront, meaning that you need to have fair access to healthcare. And so COVID-19 is a great prime example of why you need to know what equity is. COVID-19 taught us a very valuable lesson that what we perceive to be equal is not necessarily equitable. What we perceive to be fair is not necessarily fair to someone else. And so I'm going to share my screen here again. I want to show you a couple of different things we did just to show you. So I just mentioned, this is what we did at AtlantiCare. We, at our AtlantiCare organization hospital, we have what we call employee resource groups. And every resource group is based on different identities. So you have one for Latinos, one for African Americans, one for women in leadership, one for those who are differently able, one for those who like wellness, one for those who like spirituality, those for the Asia Pacific Islander community. We had so many, we have 10 different groups that deal with different identities. And so what we did was we said, okay, how do we use our resources to make sure that everyone has fair access to the vaccination? And so we called from February 15th, and I'll never get it because it was Valentine's Day weekend. And my wife was asking me all these questions. She was saying, why are you talking to everybody but me, right? On Valentine's Day. And I still owe her a gift for that. But nonetheless, we called people from February 15th till now, and we reached out to local community pastors. We reached out to our diverse communities. We reached out to our local school districts. We reached out to our teachers. And then, of course, we reached out to our 75 and older campaign. And we had a significant increase in people getting vaccinated. And I'm going to show you, check out these numbers. Within the different Hispanic communities, by March 1st, only 986 people were vaccinated. But once we got our hands on the names and the numbers and we began to call, look what happened a month later. That jumps to 4,028 individuals in the Hispanic community. Look at the Asian community. March 1st, 1,900. We jumped to 6,300 in a month. African Americans, same thing, 947 to 2,801. If you look at our non-Hispanic white, 11,000 to 24,000 individuals vaccinated. What is my point? Equity is about ensuring fair access, and sometimes you have to get engaged into outreach. You have to learn how to work within your communities. You have to learn how to tap into the resources that you have. Does that make sense? Am I making sense? Am I boring you? Please tell me I'm not boring you. I'll keep going, even if I was, but I just wanted to make sure I wasn't boring you. But equity, you know, I look at COVID-19 as an eye-opener because it goes beyond COVID-19 when you talk about equity. Once we get through this battle of COVID-19, which we will, because we're getting people vaccinated, we still have to apply the same pressure and the same momentum to other healthcare disparities in our communities. Equity is just not healthcare related. Equity has to do with everything that comes in contact with you. Equity can be found in school systems. Equity can be found in your job placements. Equity can be found in your hospitals. Equity can be found in the things that you like to do in sports. It is our responsibility as citizens of our communities to make sure that things are not just equal, but they're fair and equitable. The fact that you all are right here looking at me means that you either have Wi-Fi or a good phone. But don't you know there are people who don't have neither? And so how do we get this information to them? The question is, how do we make this fair and accessible to them? That's for us to come up with, to make sure that we're always finding ways to make sure our communities have fair access to the resources in the community. So when you look at COVID-19, the reason why we want to talk about this is because we want to make sure that people are not getting the vaccine because they can't access it. We have to go out and talk to the communities. We have to go out and figure out what we can do. You know, I heard it was a really cool story. Cedar Creek High School. I know Cedar Creek High School. I went to go record them yesterday. So their teachers, we were working with their teachers to get them vaccinated. And it was so cool because when we went to the school to get them vaccinated, we found them in their computer labs. We were like, what are you doing in your computer labs? They were calling senior citizens in the community to help them get access to the vaccine. They were utilizing their resources, the computer labs. They were utilizing their phone lines to help senior citizens get access to the vaccine, because there were, again, some senior citizens that said, I don't have time to sit all day. I have a wheelchair. Is somebody going to help me? Is somebody going to help me call this number? And so again, it goes back to your community service, as we all are here as community servants, to find out how we can make sure that healthcare and the COVID-19 vaccination is accessible to our community. Simple as that. And so I just want to open up the lines here for a quick second. Any questions around that? Have you experienced anybody who feels that, hey, what's up, Kara? I see you there. Have you seen anybody or heard from anybody that says, hey, I don't want to get the vaccine because it's too hard and I don't want to walk down to the mega site. I don't want to do this. Anybody experience that? Anybody have any grandparents? I'm not getting that vaccine.
Honestly,
I'm not getting that vaccine.
Christian, I'll say it. Yes, honestly, my sister was one of those individuals. I mean, not to mention that she was afraid, but she was like, sis, I don't want to sit here and stand in line at the mega site. I don't have to take the bus all the way over there, and I think as the vaccine became, wider, well, I guess more available, readily available at other locations, she ended up being able to get one easier, but that was her first, gripe.
It's so interesting, right? So there are individuals, and let me just say this, the vaccine, I always tell people, do your own research, right? Do your own research so you feel morally that you made the right decision. But it's so funny though, the people that was telling me, I'm not getting that vaccine because I'm just not getting that vaccine. But when they found out that we had access to get them scheduled a lot quicker than the system would, people started coming like floodgates. Oh, I'll get the vaccine now. So it wasn't that they didn't want to get it. It was that they just were fearful that they would not have the access to get it. And so sometimes people have such an impoverished way of thinking that sometimes when they're not used to getting something, when they're not used to having access, when something is finally made accessible to them, they reject it because they're not used to someone saying, no, this is for free. That's the other thing. There was a lot of issues where people thought they needed insurance. You had people who may have been undocumented who wanted to get the vaccine but were afraid to show up because they thought they may get deported. All of these come with equity. But our job is to say, no, this is a safe space for you to come and get healthy and get vaccinated. But it was so fascinating to me, as point. It was like the more people started getting vaccinated, it just seemed like people was calling me every other day. Christian, sign me up. I want to be there the first thing in line. And then they start, and Kara's on the call, she can tell you, in AtlantiCare, people just started reaching out to us. I remember someone called my wife's number, was like, is this the man's wife that can get us access to the vaccine? And I'm like, whoa, that's deep. People found my wife. But, I heard Dr. Wilson last week, and I heard Dr. Eileen talk a little bit about the safety of the vaccine. And again, the vaccine is safe. But again, I always tell people, if you don't feel safe, that's where you go to your primary care doctor. But again, my job is not to make sure just that you get the vaccine. My job is to make sure that you always have access to it, regardless if you want it or not. Anybody else have that same similar experience? With anybody? I heard things such as, Black people don't get the COVID-19. And I'm like, well, where were you at in December when I got it? Or maybe my parents been lying to me about who I really am. But nonetheless, there were so many different rumors going around that was creating such a stir and it's creating such a fearful mentality. And there's nothing wrong with being fearful, but there's another part you have to be educated. I always tell people, if you're going to do something fearfully, make sure you do it educated. But that still does not negate the fact that we need to have equal, equitable access to the vaccination. You know, I'm so proud of AtlantiCare and that we've found ways to make sure people have a chance to get the vaccination in various ways. So you can go to your primary care doctor. You can probably go to the mega site. You can go to the federally qualified clinic on Tennessee Avenue, the FQHC. So many different avenues at AtlantiCare that you can get your vaccine. And then you go outside of AtlantiCare, you can go to Walgreens, you can go to Walmart. I thank you, Lori. I love this. I think most people are afraid reactions because of the media and the word of mouth. You know, I will tell you, it was kind of funny. Wait, maybe not, it's not funny. But do you all remember the first day the vaccination was given and there was a woman who was a nurse on national TV talking about the reaction, and right in the middle of the interview, she passed out? You remember that? And I'm like, that was probably not the most championing thing to do if we want to get people vaccinated. But again, to your point, Lori, there are so many different people who are going off of the media's perceptions. You can't go off of what people are saying. Trust me, I had after I received my vaccination, I had, like some of the reactions that they talked about, you may get a headache and things like that. Then there was a group of people that didn't have no reaction at all. It affected people's bodies differently. So my point is, you always want to do your own research. And I know it's almost 6:30, so I'm almost going to wrap it up here. But I want to show you something as well of someone taking this into their own hands. Oh, wait, am I sharing the screen? Oh, yes. Yes, I'm going to talk about that in a second. Yes. Yvette, thank you for sharing. I'm going to talk about that in a second. Do anybody know who this person is? You ever heard of this person before? Dr. Isla at Stanford. She is a pediatric surgeon in Philadelphia. This doctor, amazing. She admittedly had some concerns around the vaccinations, and she saw the discrepancies within communities that were vulnerable, and she went to work. She, being a pediatric surgeon, created the Black Doctors COVID-19 Consortium, and she started off with doing tests, drive-through tests. Then when the vaccination came out, she hosted in one weekend a 4,000-person vaccination clinic at the Leocora Temple in Philadelphia. Because why? She was afraid that people in Philadelphia would not have the same access to the vaccine as other places. And so she took it upon herself to take the lead in this. And this doctor, amazingly so, did a great thing and really, number one, identified the opportunities to have equal access and equitable access, and did the work. And so my point is, you want to make sure that you also carry that same burden, that responsibility to make sure that people have access to things. I want to go to this comment really quick in the chat. From Yvette, it says, we also need Spanish and other languages translated for those who aren't sure of getting the COVID-19 vaccine and need help getting appointment or questions answered. So I'm glad you said that, Yvette. We have that at AtlantiCare, and they're called ALMA. That is the employee resource group. They are the Hispanic resource group at AtlantiCare that calls people and they translate and they answer questions. And so, and they schedule them on the spot.
And to dovetail with that, Yvette, please reach out to the Boys and Girls Club. We have multilingual COVID educators placed across the city that have their educational material in multi-languages. They are able to schedule your appointments in a language that you are comfortable in. So please think of both AtlantiCare and the Boys and Girls Club as a resource for that.
Absolutely. The Boys and Girls Club is doing a phenomenal job with really extending beyond their mission into the community. And so I'm just so grateful to be a part of that. I want to let me just see if there's, I want to do one last thing. So hopefully, before I even do that. So again, what is equity? Equity is fair access. Equality is all things equal. So when we say equity with the COVID-19 vaccine, we're saying that everyone has the right, the opportunity, the fair access to receive the vaccination. So why is that important? Because when, a threat to, I'm gonna use Dr. King for a second here, a threat to justice anywhere is an opportunity for injustice everywhere. And so why is that important? When you see inequity in anything, specifically with COVID-19, if nobody speaks up, it will always persist and it will always maintain, and it will always have a community that is not fully amped with the healthcare resources that they should have. And so why is it important that we have a town hall about this? Is because it's one thing to say, yeah, get the vaccine, but it's nothing to understand that you need to make sure people have the fair access to it. We need to make sure people have internet to register. We need to make sure people have a wheelchair. When I got to the mega site, my first day there, the first thing people were yelling at me, not yelling, but first thing people were saying, Christian, can you give me a wheelchair? Why? Because you have people who are 65 and older who have to walk the convention center. And so we had to get the National Guard involved. We had to get a bunch of wheelchairs. We wanted to make sure that their experience was pleasant so that they didn't just say, you know what, I'm not getting a vaccine because that's too far. I don't want to walk. I don't want to stand up. I don't want to do none of those things. So you have to make that experience pleasant and you got to make it equitable. And so my hope is that you all heard today, you know, I heard Dr. Eileen, I heard Dr. Wilson, I heard my colleague Mike Heck last week talk about the clinical piece to the COVID-19 vaccination. But the most important piece is, as you all are in communities of, you know, various diverse areas, you need to make sure that you can be a sounding board to make sure equity is everywhere with the COVID-19 vaccine. If you see something, say something. If you listen, we had a situation where we thought, you know, someone was being given the wrong information. And we all know when someone is given the wrong information, that there's an opportunity that everybody will be given the wrong information. And so if you see something, if you hear something that's not sounding correct, you want to say something. I want to share this with you. Speaking of equity and kind of a AtlantiCare homerism here, I want to share with you something that's taking place tomorrow. And you heard it here first, and you probably already saw it. But so tomorrow, AtlantiCare at the Atlantic City Healthplex is offering the Johnson & Johnson vaccine for anyone 18 years or older. This is one shot, no appointment necessary. Wednesday, tomorrow, May 12th, 9 a.m. to 1 p.m. And they are also, check this out, they're giving you a free sandwich from the White House sub shop. So talk about equity. We're not only making it so you don't have to register, you can just show up. We're gonna give you some food to go with it. So if you know anybody that's looking to get the Johnson & Johnson or one shot, or someone who's having difficulty getting the shot, they can show up tomorrow at the Healthplex, which is in Atlantic City on Tennessee and Atlantic Avenue, and you can get the shot. I will be there. I will have a smiling face for you. If you have any fear, any nervousness, I will be there to walk you through it. But again, it's not about me telling you to get it. It's about making sure that you have access to make a decision on your own. And so again, this is the Johnson & Johnson. And before you all think in your mind, oh, isn't that the same vaccine where people are getting blood clots? So the research has been done. There was only 6 people in the country that had that one rare situation with blood clotting. But if you don't know that, if I don't tell you that, you will think Johnson & Johnson is just a vaccine that everybody gets blood clots with, which is why we have these town halls. So I wanted to share that with you. If you have any questions about that, you can always reach back out to me. So I'm going to share my last screen of my contact information here. Let me just do that. So you all, it is 6:32, and I don't want to overstay my welcome here. So that is my information. So you can reach me anytime at christian.ragland@atlanticare.org, or simply you can reach me at diversity@atlanticare.org. I am always willing to answer questions. I'll get you connected to a clinician or the Boys and Girls Club. They have all of the resources needed to be helpful, to be educating, to be able to teach you certain things around COVID-19. But again, the highlight around this today is you need to understand that the COVID-19 vaccine needs to be equitable. And so I'm gonna turn this back over to my friend Michelle here, who has done a great job of making sure I stayed on cue and not over my time limit here. So I wanna thank you all, and I hope there are some questions that I can talk to you about.
Thank you so much for that amazing presentation, Christian. So at this moment, does anyone have any questions? You can unmute your mic or write them in the chat box. Or once again, you guys can email Christian Ragland or the Boys and Girls Club for any information or help that you need. So we're gonna move on, and we'll have Mia Williams speaking on why she decided to get the COVID vaccine.
Good evening, everyone. My name is Mia Williams. I'm the STEAM director here at Boys and Girls Club of Atlantic City. And I chose to get vaccinated primarily because in December, I actually contracted COVID-19, and I suffer from asthma, and I've had multiple instances, where my asthma has flared up, but nothing to the extent of what COVID was like. I mean, to a point where I wasn't able to walk up my own steps. And at one point I was actually hospitalized and received IV medication and things of that nature. But, knock on wood and thank God I have, come through that. But for me as an educator, it was about making sure that I was personally, yes, protected, but also making sure that the children that I teach on a daily basis were also protected as well. And it really is important, that we as just citizens, care about one another and are willing to, create the equity that Christian spoke of, for each other so that we can all, live in a way how we were before, without mask and back to traveling and being with our families as well. So, similar to Christian, I had a little bit of, some reaction, a headache. But when I say it was like not even a drip in comparison to what the actual COVID was like, oh my goodness, nothing like it. So, like I said, that was all of 24 hours. And it's a different situation when you know something is going to end versus you just sort of being on this trajectory where you're concerned and scared and you don't really know where it's going to happen, what's going to happen. But, I absolutely endorse everyone getting vaccinated and continuing to socially distance, and fingers crossed we'll be out of this soon. So thank you so much, Michelle.
So as of right now, we're going to pick the winner for the AirPods. Let's see.
Drum roll. I'll do the drum roll.
So our winner is Lori for the AirPods. So we'll be reaching out and you have won AirPods. Congratulations.
Hi, Lori. My name is Renata. Thank you so much for joining us this evening. Can you please send me your contact information to the address in the live chat? It's covid.ed@acbgc.org, and we'll be sure to get them to you.
Okay, thank you.
Lori, are you a medical assistant?
I am.
Oh, you remember me? Do you remember me?
I vaguely, because when I apply jobs, I remember trying to get at AtlantiCare. Yeah.
Oh, nice to see you again.
Yeah,
Maybe
thank
I can
you.
borrow your AirPods.
So I'm on this call. I'm working for actually for Volunteers in Medicine in Egg Harbor Township and K-May Courthouse, and I'm currently in the CHW program.
Awesome.
So I'm working on that.
Awesome.
So a lot of these terms, they're all coming around.
Yeah, that's awesome. That's
tonight.
Awesome. It's great to see, number one, the Boys and Girls Club being the leader in all of this, but connecting the dots, and that's inclusion. If I could throw that word out again, inclusion is connecting all of our different things so we can find a way to work together. So that's awesome.
Okay, so thank you, Christian Ragland again, and Mia Williams, and everyone that has joined. I just want to remind everyone that our next town hall would be May 25th. And if you have any questions, please remember that you can reach out to the Boys and Girls Club or AtlantiCare. But once again, thank you everyone who has joined, and you have a great day.